తలనొప్పి, నరాల బలహీనత, మూర్ఛవ్యాధి, పక్షవాతం, బ్రెయిన్ స్ట్రోక్, బ్రెయిన్ ట్యూమర్స్, మెడ, వెన్నెముక సమస్యలు, పక్షవాత సమస్యలకు పరిపూర్ణ వైద్యం. మన దేశంలో ఎక్కడా లేని ఆపరేషన్ థియేటర్, అమెరికాలో జరిగే వైద్యం ఇప్పుడు గుంటూరులో. చిన్న కోత ఆపరేషన్ల ద్వారా కేవలం 2 రోజుల్లోనే డిశ్చార్జ్. డాక్టర్ రావ్స్ న్యూరో హాస్పిటల్, గుంటూరు. సంప్రదించండి 9010056444, 9010057444.
What is Cushing's disease? Cushing's disease is a specific form of Cushing's syndrome caused by the overproduction of a hormone called cortisol. Cushing's syndrome refers to symptoms resulting from prolonged exposure to high cortisol levels. What causes Cushing's disease? A benign tumor usually causes Cushing's disease, called an adenoma, on the pituitary gland. This tumor leads to excessive adrenocorticotropic hormone, ACTH, production, which in turn stimulates the adrenal glands to produce more cortisol. What role does the pituitary gland play in Cushing's disease? The pituitary gland, located at the base of the brain, produces ACTH. In Cushing's disease, the excessive production of ACTH triggers the adrenal glands to release excess cortisol. What are the common symptoms of Cushing's disease? Common symptoms of Cushing's disease include weight gain, especially in the abdomen and face, moon face, high blood pressure, muscle weakness, thinning skin, easy bruising, and mood changes. How is Cushing's disease diagnosed? Diagnosis involves blood tests to measure cortisol and ACTH levels and imaging studies like MRI to identify pituitary tumors. A high-dose dexamethasone suppression test may also be used to confirm the diagnosis. What is cortisol, and how does it relate to Cushing's disease? Cortisol is a steroid hormone that regulates various functions in the body, including metabolism, immune response, and stress management. In Cushing's disease, excessive cortisol production leads to various health issues. Can men develop Cushing's disease too? Yes, Cushing's disease can affect both men and women, although it's more common in women. What are the treatment options for Cushing's disease? Treatment options for Cushing's disease include surgery, medication, and stereotactic radiosurgery radiation therapy, depending on the underlying cause and severity of the condition. How does surgery help treat Cushing's disease? Surgery is often recommended to remove the pituitary tumor causing Cushing's disease. This procedure is known as transsphenoidal surgery. What is endoscopic transsphenoidal surgery? Endoscopic transsphenoidal surgery is a minimally invasive technique where the tumor is accessed through the nasal passages, avoiding open skull surgery. Are there medications for managing Cushing's disease? Yes. Medications such as cortisol-lowering drugs, e.g., ketoconazole, mifepristone, may sometimes be used to manage symptoms. When is radiation therapy considered for Cushing's disease? Stereotactic radiosurgery radiation therapy may be considered if surgery is not an option or if the tumor persists after surgery. What happens if Cushing's disease is left untreated? Left untreated, Cushing's disease can lead to serious health complications, including high blood pressure, diabetes, osteoporosis, and an increased risk of infections. Does Cushing's disease only affect the pituitary gland? Cushing's disease can cause many symptoms beyond the pituitary gland, including bone loss, muscle weakness, and cardiovascular issues. How is Cushing's disease diagnosed and treated? A multidisciplinary approach involving endocrinologists, neurosurgeons, and other specialists is essential for an accurate diagnosis and effective treatment plan. Can lifestyle changes help manage Cushing's disease? Lifestyle changes may include adopting a balanced diet, regular exercise, stress reduction techniques, and adhering to medication regimens. What are the long-term effects of untreated Cushing's disease? If left untreated, Cushing's disease can lead to serious long-term health effects, including cardiovascular disease, bone fractures, and decreased quality of life. How can Dr. Rao help in treating Cushing's disease? Dr. Rao specializes in treating Cushing's disease, utilizing advanced techniques like endoscopic transsphenoidal surgery for precise tumor removal. Why choose Dr. Rao's hospital for Cushing's disease treatment? Dr. Rao's hospital is renowned for its expertise in neurosurgery, stereotactic radiosurgery, and endocrinology, making it an optimal choice for comprehensive Cushing's disease treatment. Where can I learn more about Cushing's disease and its treatment? For more information about Cushing's disease and treatment options, contact Dr. Rao's Hospital at 901-005-6444 or visit https://drraoshospitals.com.